This audio lecture is going to focus on balance and balance testing. When we look at balance, balance is fundamental to most activities, including even standing still. The definition of balance is the body's ability to maintain an equilibrium by controlling its center of gravity over its base of support. When we look at balance, it involves three distinct systems that all work independently but also can work together. These systems include the vestibular system, the oculomotor system, and the somatosensory system. All of these systems are necessary for static and dynamic balance activities. Balance can also be influenced by strength and by sensory input from the central nervous system, or CNS. Our three main components of sensory input that impact our balance are our vestibular, oculomotor, and proprioceptive, or somatosensory system. Our vestibular system occurs within the inner ear and sends messages to the central nervous system about static position and motion. Our oculomotor system provides feedback about the position of the body in space using vision or visual cues. Our somatosensory system are our sensory receptors that provide afferent information to the central nervous system. These receptors occur throughout our body, including in our skin as subcutaneous receptors, our muscles, our tendons, etc. Some other factors that can influence balance include cognitive awareness of balance and previous injuries. Can you think of a way we could eliminate the vestibular system and still challenge balance? One way to do that is by turning our head. This changes the levels within our inner ear and can help disrupt that message that's being sent to the central nervous system. What about a way to challenge our other systems and eliminate the oculomotor system? The way to do that is to close our eyes. What about our proprioceptive? What's one way to inhibit or affect that system? One thing we could do to challenge our proprioceptive system would be to stand on an uneven surface. Similar to balance, but distinct, is proprioception. The definition of proprioception is the body's ability to transmit the position sense, interpret the information, and respond to consciously or subconsciously to stimulation through appropriate execution of posture and movement. Within proprioception, we have exteroceptors, and these provide information to the body's external environment. And we have interoceptors. These provide information about the body's internal environment. Proprioceptors provide information on the position of the body or body part in relation to space. When we're examining balance, there are two distinct types of balance. We have static balance and dynamic balance. Static balance is the ability to maintain an upright posture and to keep the line of gravity within the limits of the base of support. Some examples of static balance activities include standing or sitting. So, standing or sitting, we're able to maintain that upright posture and keep that line of gravity within the base of support. A way to change your base of support when you're standing is to stand with your feet closer together or farther apart. That changes that base of support, but either way, we're keeping that line of gravity within those limits. Dynamic balance is the ability to maintain stability during weight shifting, often when we change the base of support. So some examples of dynamic activities include walking, jumping, running. So we're still able to maintain that stability, but our base of support is constantly changing, and so we're needing to be able to adapt during that weight shifting phase. When it comes to balance assessments, we have several different tests that we can use. First, we're going to talk about some of our static balance tests, or tests where we're not necessarily moving. The first one is called the Romberg test. So I'm going to go through the steps of how to complete the Romberg test. So for the Romberg test, you're going to instruct the client or the patient to first remove their shoes. Our shoes give us some increased stability, and balance activities are often more challenged when we remove that stability component. We want to instruct them to put their feet together and cross their arms over their chest. You're going to do 3 different trials of balance with their eyes open, followed by trials of balance with their eyes closed. Now, if the patient or client has significant balance impairments with their eyes open, we're not going to progress to eyes closed. How we administer this is each trial is a maximum of 30 seconds. What you're going to do is you're going to time the patient until an error occurs. And then you're going to note the time that error occurred with a maximum time of 30 seconds. So once an error occurs, stop that trial, document the time, and then take a few seconds, move on to the next trial. An error is counted if there's excessive sway, movement of the feet, movement of the upper body or arms, or a loss of balance. So again, with this test, 3 trials eyes open, followed by 3 trials eyes closed. For all of our static balance tests, especially when eyes are closed, we want to be in a position of safety for the client or the patient. So we want to stand to the side of them with one arm in front of them, one arm behind them, not touching the patient, but there to provide stability in case they were to lose their balance. Very similar to the Romberg test that we just went over is the sharpened Romberg test. The only difference is that this test is completed in a tandem stance. A tandem stance is when one foot is directly in front of or behind the other foot. For the sharpened Romberg test, the non-dominant foot is the foot in front. One way to ask a patient what their dominant foot is what foot they would kick a soccer ball with. The foot that they would kick the ball with is the dominant foot. So we would want the dominant foot in the back. Again, you would have the patient remove their shoes. In this picture, this adult has their shoes on. Shoes on is appropriate for older adults if they have conditions that do not allow for the removal of shoes. You stand in the tandem stance, arms crossed over their chest, 3 trials eyes open, followed by 3 trials of eyes closed. You time them the same way. Same trials are included if there's excessive sway, movement of the feet, movement of the upper body or arms, or loss of balance. The last static balance test that we're going to review is the BEST test, or the Balance Error Scoring System. You might have done this test in some of your previous courses or labs, but we're still going to go over it. So when we do the BEST test, shoes are again removed. The testing position is a little bit different compared to the Romberg. So for the BEST test, our hands are going to be on our hips, and all trials are going to be with eyes closed. Because of that, we want to make sure that we're close to our patient or our client for safety. On the BEST test, we also time each trial for only 20 seconds, and you will go the entire time, but instead, like in the Romberg, where you end the time when there's an error, for the BEST test, you count the number of errors. You don't need to note when they occur, but note how many occur in each trial. There are 3 different positions for the BEST test. The first is a double leg stance with feet together, hands on hips, and eyes closed. The second is a single leg stance on the non-dominant foot. Remember, a way to determine dominant foot is what foot they would kick a soccer ball with. And then our third position is going to be a tandem stance with the dominant foot in front. Once you complete 3 trials, all 3 of these trials, 1 trial for each position, you then complete them on a soft surface. So start on the ground and then you transition to a foam pad. You're going to tally the errors for each trial, and then you're going to total the number of errors. If 2 errors occur at the same time, it's counted as 1 error. Errors for the BEST test differ compared to the sharpened Romberg and the Romberg test. So errors on the BEST test include the following 6 components. 1, moving the hands off the iliac crest, opening the eyes, a stumble or a fall, abduction or flexion of the hip beyond 30 degrees, lifting the forefoot or the heel off the ground, or remaining out of the testing position greater than 5 seconds. If any of those things occur, it's considered an error. And again, you're counting the total number of errors for each position on each surface within that 20-second time trial. Here's some pictorial evidence of the different trials and an idea of the scorecard that you could use. So in picture A, we have the double leg stance on the firm ground. Picture B is single leg stance on the firm surface. C is the tandem stance on the firm surface. And then if we look at D, it's double leg stance on the foam. E, single leg stance on the foam, followed by F, tandem stance on the foam. So for each of these, you would total, you would indicate the number of errors for each position on each surface. Then you have a total for the firm surface, a total for the foam or soft surface, and then an overall total of errors for the 6 different conditions. Transitioning from our static balance tests, now we're going to talk about our dynamic balance tests. The first one we're going to talk about is the Star Excursion Balance Test. The Star Excursion Balance Test, sometimes abbreviated as SEBT, is considered the gold standard for dynamic balance testing. The Star Excursion Balance Test measures dynamic balance in 8 different positions. However, research has been done extensively, and the 3 directions that are most valid are the anterior, posterior medial, and posterior lateral directions. This test has been pared down to include those 3 directions and is referenced as the Y balance test, which we will talk about next. But I wanted to introduce you to this idea because this test is very often used in research and in the literature. So for the Y balance test and the Star Excursion Balance Test, the procedures are the same with the exception of the Y balance test only measures 3 directions and the Star measures all 8 directions. The biggest thing to remember with both of these tests is that the stance leg is the leg being assessed. So the leg they are standing on is the leg you are assessing. What you're going to have the patient do is stand in the middle of the Y with the middle of their foot or their arch kind of in the middle of that Y. They're going to put their hands on their hips. They don't have to keep their hands on their hips the whole time, but you want them to be in an upright position. They're going to reach their opposite limb as far as possible and lightly touch the line, and then return to the starting position. They need to keep their heel on the floor of their stance leg, and when they touch the line with their other limb or contralateral limb, they're just supposed to lightly tap the floor and return. They're not supposed to shift any weight onto that reaching foot. If they're unable to return to the starting position, that trial doesn't count. In terms of the test administrator, you are going to mark where the patient touched the line with a pen or a pencil on the tape. We usually recommend that you complete all trials on each limb before you measure. You want to complete the trials or the reaches in a circuit on the same limb. So you want to go anterior and then posterior medial, posterior lateral, or any other rotation of those for trial 1 before proceeding to trial 2. You complete 3 trials in each direction per limb. And then you want to complete all of the trials on limb 1 before you transition to limb 2. When you've completed one limb, the test administrator should measure from the center of the Y to each mark to the nearest ½ centimeter. Here's a picture of what the Ys look like. Remember that your stance leg is the leg that's being assessed, and then the directions are all in relation to the stance leg. So again, your directions are going to be anterior, posterior medial, and posterior lateral, but depending on which leg you're standing on, the posterior medial and posterior lateral are going to be different. When you're scoring the Y balance test, you've taken 3 measures in each direction for each limb. The first thing that you want to do is average the distance in each direction for each limb. So at first, we're just going to talk, let's say we collected data on the left leg as the stance leg. So we have 3 different anterior measures, 3 different posterior medial measures, and 3 different posterior lateral measures. The first thing we want to do is get the average distance for each direction. So add all 3 anterior measures up and divide by 3 to get our average. Do that for the other 2 directions as well. Then we need to get our relative distance. So in order to get relative distance, we also need to measure leg length. So leg length is measured from the ASIS to the distal pole of the medial malleolus on the leg that you're assessing. So we would need to measure, in this example, the left leg length. So in order to get our relative distance, we're going to get a relative distance for each direction, for the anterior, posterior medial, and posterior lateral. How we do that is we take that average distance that we had previously calculated and divide it by the leg length, and then multiply it by 100 to get a relative distance percentage. That is then repeated for the other 2 directions. Last, we can get a composite reach. So how we get our composite reach is we're going to take our average anterior for the left leg measurement, our average posterior medial left leg measurement, our average posterior lateral left leg measurement. We're going to take all of those and we're going to add them together. And then we're going to divide that number by 3 times the leg length. And then multiply that answer by 100 to get our composite reach. So we just talked about how to measure and calculate everything on the left leg. The same is true for the right leg. So we want to calculate all of one limb before the other. We most often think about balance as just lower extremity balance, but we also have dynamic balance when it comes to the upper extremity. Much like we did the Y balance test on the lower extremity previously, we can do the same thing on the upper extremity. The only difference is that our positioning and our starting position is a little bit different, and we're going to be reaching in a few different directions. So just like for the lower extremity, our stationary arm is going to be the arm that we're assessing. So in this picture, we're assessing the right arm, okay? So if we look in that top left box, we can see the right arm is in the middle, and then the left arm is on the slide. So our first direction that we can go for the upper extremity Y balance is medial or out to the side. And then we have our inferior lateral and our superior lateral reaches, as you can see in the bottom two pictures. Scoring is exactly the same, 3 trials each direction, each limb. When we're measuring limb length, we're measuring from the spinous process, which is that pointy part in the kind of the back of your neck, to the distal tip of the third finger. So the tip of your middle finger is how we measure leg length or limb length. And then all of the rest of the scoring for the upper extremity is the same as the lower extremity. Our last dynamic balance test for the upper extremity that we're going to talk about is the closed kinetic chain upper extremity stability test. So what you do is you make 2 lines 3 feet apart. You start in the push-up position with one hand on each line, and then you're going to alternate touching each line as fast as you can for 15 seconds, and you tally or total the number of line touches. Each time you touch a line counts as 1. And then 3 trials of this test are completed. Again, counting how many line touches you have within that 15-second interval for each trial. I know that I verbally explained all of the different balance tests. However, I also know that a verbal explanation is not always clear and easy to understand when it comes to these kinds of assessments. Here are different YouTube links that go through the different balance tests. I did not create these YouTube links, so there might be slight variations in the execution of these tests, but it is a good way for you to get a better idea of how the tests are conducted visually, if that's helpful for you. The following are some review questions for the physical fitness, balance, and flexibility components of these lectures.